Hi, welcome back. Here and next is the interventions. What we have to do in an airway problem is we need to suction, we need to jaw thrust maneuver, and you can use the help of airway adjuncts such as airway, laryngeal mask airway, or a normal Goodell airway. All this can be used in case to relieve the airway and clear the airway and to help the patient in breathing. In case of circulation problem, we can do the interventions such as CPR, defibrillation, and we have to resuscitate with the fluids and blood products, or if required we can give inotropes. These are all the intervention which is coming under the circulation. Where in case of airway, again oxygen helps if only the airway is open. So airway is patent, then only we can do an airway problem to get it cleared. And similarly, when compared to the circulation, oxygen is useless until there is not an established circulation. So regular and established circulation is much essential before the oxygen to be supplied. Here in example with the airway problem is if the patient is unconscious, patient is having an obstructed airway, these stands under priority. And similarly with circulation problem, the patient, though he might be talking, patient is he looks stable, but he might be having a massive GI bleeding. So this always stands out under the highest priority. So the NCLEX keyword what we should remember in airway is if the air cannot get in via the airway because of block, obstruction or anything, then it is the highest priority. And the NCLEX keyword under the circulation is blood is not moving out, then it is the important to be noted in circulation problem. Here the patient dies in airway problem is just because of hypoxia, and in case of circulation problem the patient dies because of ischemia and severe shock. Okay, these are the few things we need to remember when you are seeing the questions under this headings. So I hope this small hint is helpful for you to see which problem is more priority in selecting and choosing the correct options. Thank you and happy learning.